Hey everybody, we are live on Facebook today for the launch of Skills Not Pills movement. I am so delighted to be with you today. I'm your host, Carrie Hummingbird, and we are live today to kick off 30 days. 30 skills, 30 experts for the month of May, which is Mental Health Awareness Month, if you're not aware of that. And really just so excited today to kick it off with an amazing woman who I've met through the course of opening up to do this work, Dr. Neha Sangwan. Welcome, Dr. Neha.
Hi, everybody. Glad to be here.
Yay. So, what we're doing here is really important because, I think we all admit that, our system of health is a little not quite in the right alignment. Some pieces are there, but not all the pieces, and everything's not really aligned correctly. And so when we're talking about skills, not pills, we're really exploring the breadth of how can we bring this thing into alignment in a way that works for us as a culture and as a medical community. So I wanted to get your perspective a little bit on, this idea of skills, not pills. I know that some of the work that you do with clients is actually helping them, if they want to transition off medication, to be able to do that, to work with their doctor to bring them into that place. Tell us a little bit about that journey. What does that look like for somebody who's wanting to make that transition?
Yeah, so by training, I'm an internal medicine physician. So I believe that medications can be useful. I think you just need the right dose of medication, of the right medication for the right person for the right amount of time. And it can be an incredibly useful experience. I also believe that our culture has gone a little off the deep end on overprescribing. And as to be fair, it's not just physicians that are overprescribing, it's also patients who expect to get a quick fix. And so as we begin to talk about this, I think it's really important that we all own our part in this. Right?
Yeah,
so,
absolutely. That's why it's skills, not pills.
Yes.
Yeah.
And what I want to be clear about is I'm not a doctor who's saying, like, I don't think you should use medications, right? I think there's a time and a place for that being absolutely appropriate. So, that being said, I would also say that I think there are plenty of internal medicine physicians and doctors out there who do prescribe pills and can take over that part for me. I think in my decade of being in the hospital, and now it's been 2 decades of me being a physician, that some of the harder things to understand and some of the places where a lot of us get stuck is when we know we're using a pill to numb a symptom, but it's not curing the issue. It's not actually solving the problem, right? And so in that space, many people are looking for how can I, what else is happening and how might I be able to empower myself and heal my body so that I don't need this headache medication or this insomnia medication or anxiety or antidepressant medication. Now, anxiety and antidepressants or even insomnia, like that medication is phenomenal. When you're in an acute crisis, you need some help and you need a bridge to help you kind of get through what's happening. I don't believe that they're a long-term solution, like an endless, ongoing, you're going to be on this for the rest of your life type of solution. It can be used that way. And for the people who want other answers, what I do is I work with them. That's on a physical level, right? So let's say I have a headache and I take Advil for that headache. Listen, awesome. I'm going to get through my next deadline. It'll get me through the rest of the day, but it does nothing to stop my next headache.
Yeah, exactly.
Sometimes the cause of my headache is that I'm dehydrated, and it might be on a physical level, right? There might be it, but it also might be that I just got in a fight or an argument with my child, with my partner, with my boss, with a patient, whatever it is. And it might be as a result of me being afraid of anger or whatever it is. And so when there's recurring symptoms that happen in your life, you've gotten them checked out by a doctor to make sure that there isn't some tumor in your head, right? Like there's no physical cause there that they can find. Then it's time to look on other levels. And what I do is I explore with patients and clients and physicians and nurses what else might be going on here. And so through a series of questions and drawings and them understanding, that things can be happening on other levels, I just empower them to get to the root of what's happening. And then what happens is their stress levels go down, their relationships improve, and then they don't need the medication, certainly at the doses and the frequency that they've been taking it. So it's pretty fun to watch.
So now, would you call that kind of interaction like functional medicine? Is that how you would just, I mean, I'm trying to get the language correct. So is that the right kind of person that you'd be looking for then?
No, I would actually choose. So it's a really good question.
Yeah, because there's so many names.
Right. There are so many names. And I mean, let's just blow this up even bigger, right? So there is alternative medicine, holistic medicine, integrative medicine, functional medicine, traditional medicine, right? Like, what do all these things mean? So let me just tell you the truth. Doctors themselves are unclear.
Uh-oh.
So what we have is we have traditional medicine, which evolved and basically became like a series of diagnoses. We're looking at physical symptoms. We look for, we do tests and lab results. We look at your blood count and listen to your symptoms. And then we oftentimes either refer you to a consultant, ask for a test, or give you a prescription or refer you to surgery. Okay. Mainstream traditional medicine.
Yes.
Now, when people started doing things that were outside of that, let's say they sent you to a reflexologist, or they thought acupuncture was, people started calling this all sorts of different, oh, you're doing alternative medicine. Oh, you're doing, or if somebody started to say, let's look at what you eat, they were like, oh, you're doing holistic medicine, or you're integrating things, because you're actually not just looking at the breakdown of my physical body, you're actually looking at what I eat and trying to do some prevention and wellness information. And so all these names started coming up. Really, what I'd say is there's traditional medicine, and where you go to your regular doctor at the clinic, you should be going to them for something that is an ailment, something acute that's happening, pain, you got in a car crash, your bone is broken, you have an infection or a fever, like something acute is going on and you need somebody to help you fix it now. Yeah, that's what traditional medicine is good at.
And they're good at that. They're very good at that.
They're good. That. Right.
But if you have a recurring thing, like say, you've got an autoimmune or,
chronic disease, diabetes, like, like ongoing chronic issues, what we do is, this is how we were trained, is we use acute answers over and over again, and we call that a chronic solution. But we're just like, oh, your blood pressure's too high, let's reduce that. Let me give you another pill, let's reduce that, and let's call that handled. Except it's not actually handled. You're just on more medication, right?
Yeah, and the problem is still going on, which could be a number of factors, and it could be things that you wouldn't even expect. I mean, that's been my journey. Lots of things I didn't expect, so.
Yeah, and so it's about both of those things. You need to get the acute issue. You have high blood pressure, you need to get it under control. So you don't have a stroke, you don't have a heart attack, you don't have these issues. But long term, you want to start asking yourself, what else might be contributing to this? Because a lot of people who have chronic issues think that the answer is just more medication, right?
Yeah.
But when the medication isn't solving it, it's keeping it at bay, or your symptoms are increasing, that means it's coming from something else. And you want to get really curious.
And so this is where what you're going to talk about comes into play, because really what this summit is all about in this movement is really encouraging people step into the driver's seat of your health, like become the one who's researching, seeking the experts, collecting your own information, becoming aware of your experience, documenting it, and figuring out, who do you need to ask. Because I think I talked to you a little while ago, and I mentioned that this weekend I actually went to the Paleo FX conference, where it's all about ancestral eating, right? So their idea is, if you eat like our ancestors, we're going to take away some of these problems. And in fact, they're getting tremendous results, in health with autoimmune doing this kind of thing. And I met a speaker called Chris Kressler, who wrote a book called Unconventional Medicine. And in his book, he's recommending a new model where the doctor is one aspect, like this traditional person, but you need a team. Like, you might need a health coach to help you manage your eating, and you might need someone to help you work out at the gym, and you might need a psychologist or, a mentor to help you with the psychological aspects, so you need a team. And trying to make the doctor like all of that in 15 minutes is unreasonable on the doctor, and it's unreasonable for you to expect an outcome as a patient. You need a team, actually. And so you're the one who gets to pick the team, so I love this idea. And the key piece that you're bringing to the table, which I love, which, by the way, she talks about in depth in our interview, which you can get when you sign up at skillsnotpillsmovement.com, is this idea of Talk RX. So tell us a little bit about your book, Talk RX. And I know in our interview, we talk about the 5 levels of agreement, which is a part of your Talk RX book. Talk RX, 5 steps to honest conversations that create connection, health, and happiness. Tell us a little bit about why you wrote that book.
Why I wrote the book? Well, I had burned out myself. I had actually burned out as a physician, and that was when I started my journey of understanding that I couldn't just work this body like crazy. And with all the knowledge I had, how could this have happened to me? And so I started down a journey where I started to learn about all these other alternative focuses, and I started asking my patients questions. So one thing we know in the research in medicine is that more than 90% of illness is exacerbated or caused by stress. So I started to wonder, I was a hospital physician, and I started to wonder, well, why aren't we getting to the root of people's stress? Why aren't we asking what's at the root of their stress? So when I started talking to my colleagues, they said, because, oh God, like that's like a, Raiders of the Lost Ark snake pit. Like, what do you mean? Like, how are we going to solve that? Like, we can't solve that. And so I started to realize that there was this belief that was too much. Like, you don't get into all of that. Like, we need to focus on the physical, and not just the physical breakdown of the body. That's what we're good at. So if you have like optimal wellness over here, and you have death and dying over here, right here is like the physical breakdown of the body. And then from here to here is like prevention and wellness and optimal health. What we're trained in is how most people are like somewhere here. They kind of don't feel that great. They're a little bit down. They have headaches now and then, but then they get sick. And then I'm supposed to bring them back to, kind of where they were functioning before. What I realized was, when I would talk to my patients and I started asking them questions about what was at the root of their stress, I asked them questions like, after someone had recovered from their heart attack or whatever it was, pneumonia, whatever I was treating them for, the night before I discharged them from the hospital, I would ask them a few questions. I called it the patient awareness prescription. I would say, I want to see you again, but I hope it's at the opera or at the supermarket. I hope it's not in the emergency department. So would you be willing to journal these 5 questions, about these 5 questions? And if you are, I'll spend an extra 20 minutes with you tomorrow morning, helping you figure out what's at the root of your stress. And so no one ever said no, by the way. Everybody did the questions. And so should I tell you what those are?
Yes.
So one of the questions is, why this? So why a heart attack? Like, why not your liver or your left leg? Like, why is your body, like, why is this where your body's breaking down? So why this? The second question is, why now? So why not 3 years ago? Why not 2 weeks from now? What message did you need to get from your body in this moment uh, to move forward in the best way for you? The third question is, well, since hindsight's 2020, what signals might you have missed along the way? And the fourth question is, what else in your life needs to be healed? And this brought up an incredible amount of awareness for me about the other things going on in people's lives that were manifesting physically for them because those things weren't addressed. And then the fifth question is, if you spoke from the heart, what would you say? And I stopped counting after 2,800 patients that I did this with. Every single one of them knew why they were sick. They knew what was at the root of their stress. They knew what they needed to do. And so I sat with them and I helped them with 90% of it was some sort of miscommunication, like inability to communicate with themselves or with someone they love or their boss or a toxic work environment or relationships that had long since expired. And so all these patterns started emerging. And I started to pay attention and I thought, well, if I say I'm going to be the doctor that gets to the root of their stress and helps them out, I need to compile all this information and these gifts and wisdom. I need to put it into a book so people don't have to have a heart attack to come see me. They can, pay $20 or $15 and get it in a book. So that was and that's the introduction. Like in the introduction to the book, you get the patient awareness prescription, which is those 5 questions, and you see how it played out with patients and how you can use it yourself.
I love that. I love that. Wow. I got to tell you guys, the first time that I talked to Neha, we talked for like 2 hours. I mean, so we could really go on because she's amazing. But when you sign up, you're actually going to get the first 25 pages of Talk RX, which includes those five questions she just told you about, and also a 1-page cheat sheet on the 5 levels of agreement, which she goes over in our talk. And there's also a video that goes through and explains how to do this. Like what is this 5 levels agreement? What do you look at? How do you communicate more effectively? And one of the things we talk about in our interview is the importance of being able to effectively communicate and make agreement with your doctor, because and for the doctors too out there, this is also helpful for you, because you might not be getting the agreement that you think you're getting from your patients. When you say something to them, listening to this broadcast will help you realize how maybe a lot of the times you're not actually getting the agreement you think you're getting. Isn't that right, Neha?
Oh, it's absolutely true. So when I realized that communication was at the root of so much of people's stress, we all think like, oh, I communicate every day. I'm good at it. That's not true. A lot of people communicate every day and they're not so good at it. So this is going to give you some pretty big ahas and awarenesses, whether you're a physician, whether you're a patient, whether you're just a human. It's really, really important information that I wish I had known. And one more thing I want to say to finish a thread from before, functional medicine is really an important type of medicine for people who have chronic illness. And the reason functional medicine is so good is it's kind of like this big overall view of not just your physical health, when there's a breakdown in the body, but for things like autoimmune disease, for chronic illness, they look at your whole body as a system. And then they also look at the environment in which your body functions. So the things that are changing in our water and our air and heavy metals and all these kinds of things. So not only that, they look at your mental, emotional, stress and all of that. So it's that's when you use functional medicine. And I would recommend, if someone's interested in learning more, Dr. Mark Hyman is really good at this. And he's one of the leaders. He's at at Cleveland Clinic he leads the division of functional medicine there.
Awesome. That is such great information. So, I want to encourage everybody here to realize that, like, we're having this really open conversation. I think a lot of people think maybe they see skills, not pills, and they think, like, oh, we're just battling the doctors and, oh, we're just like throwing out pills. And that's not it. It is a nice, catchy title that gets people's attention, which is exactly why it ended up being the one that I used, because you pay attention when you see something like that. And the message here is not that. The message is step into your power. Neha, me, all the people, we're all on the same side. We're on the side of health. We're on the side of creating wellness. And we don't have all the answers alone, but together we can find the answers. And, and you got to step into the journey. You've got to be the one that claims responsibility for your life. Responsibility just meaning I'm able to respond. When I have a challenge, I'm able to respond. I can take an action. And that action might be to start with someone, a doctor like Neha. It might be there. It might be to start with a health coach. It might be to start a number of places, but you're the one who has to actually make the choice to take responsibility and clean it up for yourself, because you're the only one who can. Isn't that right, Neha? You're the only one who can.
No, it's true. And you just have to, we're in a world now that is complex. And what you're really saying is when you don't have the answer, ask. When you don't feel right about something, something doesn't sit right with you, trust yourself. Listen to the experts around you, partner with us. I think of myself as a consultant, and I'm going to give you my wisdom, my expertise, my knowledge that I've gained through medical school and my experience. And you also have that. You have your own wisdom. You have your own experience. You know your body better than I do. I might be able to tell you lab results and patterns that I've seen over my lifetime, but you are the one who's lived in your body as long as you have. And so to trust that wisdom and to be curious, and to also give your doctor grace. Like, we can't know everything, even though we'd like to. we are giving you what we know, and use your own intuition and wisdom along with that to make integrated and smart decisions.
I love that. And just one more note, just one more thing I want to say about that is have compassion for your doctor. I mean, have compassion for this individual who got into this job because they wanted to help and got put into a framework where, like, they've got to see a patient like every 15 minutes and be on it all day, not stopping, and have the answer, and have people depending on them having the right answer. That's a lot of pressure to put on a person, even a doctor who's got as much training, as Neha has clearly. It's a lot of pressure. So take accountability and responsibility to be your own, health detective. And that allows somebody like Neha, somebody like your doctor, to step into the role of a partner with you, because you've already started the process of documenting and being your own detective. You've already started that process of awareness. It makes it so much easier on everybody in the system if people just take personal responsibility for their health.
I agree. And I would tell you that's another thing in TalkRx, the book, which is it'll teach you lots of practical communication skills. And it'll also help you shift into that personal, what part is yours and what part is someone else's. And sometimes that can get confusing.
Drilled into you, and we could actually, maybe learn some communication skills as a course requirement in college, and even in elementary. Like, let's start early. I mean, I know that I was trained in the Toltec lineage, the Four Agreements. Don Miguel Ruiz, my teacher Heather Ashamaro, is a student of his, still is for a long time. That book right there saved my life. It was so clear. If you haven't read that book, read that book. And you're also going to get, the first 25 pages of Talk RX, and you can go buy that book too. So there's 2 books. There's a lot of books you're going to read about. I'm going to have you start reading. So those are 2 to start with right now.
And I'd say too, know how you learn, right? If you're somebody who learns through videos, sign up for Skills Not Pills and make sure that, you connect to whoever you're listening to. Make sure you trust them, you believe them, you resonate with what they're saying. And so, or if you're somebody who's a reader and you really get your information that way, there's so many ways that you can do this.
And you can get audiobooks. A lot of this is on audio, so you can listen to it while you go on your hike in the woods.
Yeah,
Just saying.
exactly.
Awesome. Well,
Yeah.
I want to honor your time, Dr. Neha. Thank you so much for coming on with us live today for the launch of Skills Not Pills movement. I'm so glad to have you with us. Thank you so much for sharing your wisdom and your expertise.
It's been an honor.
Have a great day. See you guys. Bye.
Bye.